this is a generational issue. So this was 2002. That's, 23 years ago now that study came out, give or take. And that made a large impact. And it's one of the things that probably put healthcare for women backwards by a lot of years. But what happened is that was so publicized and so ran with in the news media, etc., that it permeated all the educational systems. And so if you were a resident or medical student or PA student or nurse practitioner student back as that study came out, then you were influenced heavily by that study as you were getting through your educational process and then going out and going into the private sector and taking care of patients. And then if you were in there and then you went on to be an academic professor, you are teaching what you learned from that study. And so without really deep diving into the study of Erickson and the study of Hargrove, you put all your eggs in a basket of this WHI study, and you learned and taught and or practiced related to that study. And I may have mentioned it before, but it's worth mentioning again. I lectured on this when the WHI first came out, and you could tell that there were serious concerns about the study. And as I lectured, I went in front of a lot of people and a lot of associations, and I always started my conversation by asking two distinct questions. The first question was, who has changed their prescribing habits based on the WHI study? And no matter who I was talking to,
How many people raised their hand?
95%. It didn't matter whether I was talking to physicians, PAs, nurse practitioners. It didn't matter. 95% across the board changed their prescribing habits based on the WHI. And then I asked the second question. How many actually read the study? And it was consistently 5%.
Yeah, those are the ones that didn't raise their hand.
So the 5% that read the study saw the same concerns I saw. Everybody else got there from the publicity of that study. And so that's where the flaw came from. It came from the publicity of the study and some inaccurate data. And then that data has all been subject to review, and subset analysis has shown that, okay, well, there may be concerns about this small little fragment here, this little box of people, but not for the vast majority of people. And